We are here today in this Expert Insight session organized by the After Cancer. My name is Mariana Arnaut, not Thierry, that's my colleague. Um, and I am the CEO and one of the co-founders of the After Cancer. And so we usually like to start these sessions talking about the why we're here, why we do these sessions, and why we exist. And then we'll get started with the session with Diane B and Diane S, um, talking about the role of therapy in different phases of cancer survivorship. So, the After Cancer is a digital platform for cancer survivors. We built this to support survivors after treatment. We like to say that treating cancer is just the beginning because there's this whole journey after treating cancer called survivorship. And our goal within our platform is to make survivorship accessible to anyone, anywhere, no matter where they were treated. And so we work mainly with health organizations like hospitals to help them create their survivorship programs in-house in a cost-efficient way that it's clinically proven and fast, and in a way that patients really love and engage with our products. But I know you came today. We're here not to hear about the after cancer. We're here to hear about Diane Benfield and Diane Simard. Um, and so I just wanted to start, and I'm going to stop sharing my screen so you can see our faces. But I would love for you guys to start by introducing yourselves. And then we'll get into dissecting your book, Diane Simard. So, Diane B, tell us who you are and what do you do and why you're here.
Well, hey everyone, my name is Diane Benfield. I am a licensed clinical social worker. I live up in Asheville in the mountains of North Carolina, and I have worked with cancer patients since about 2018. I fell into it after many years working in substance abuse, and I have found that the population is almost the exact opposite. With my with many of the addicts I worked with, they were kind of burning their life down and everyone in it. And I have found the cancer patients I work with are they want to enjoy as much out of life as possible and squeeze every drop of life out and mend relationships. And it's very energizing to me and very inspiring to me to work with cancer patients. So I fell in love with it right away, and that's really all I've ever done since. And I'm happy to be with the After Cancer for a couple years now. It's been great. Thank you.
Thank you. Yeah. Diane Simard, tell us about you.
Thank you. And hello, everyone. Thank you for being on today. And what you just said, Diane B, warms my heart because what you do is exactly what I'm interested in from the former patient survivor perspective. And so today, Diane M. Simard, I call myself now a life commentator. I actually was trained to be a print journalist, and I knew I did not want to be a newspaper reporter. So I did a lot of business writing over my corporate career. And I went through stage 3C breast cancer 10 years ago. And my story is that I had a non-aggressive grade of cancer that was behaving aggressively. So I was prescribed what I call the nuclear bomb treatment. And so I had chemotherapy up first here. And I became so concerned and anxious and nervous about the cyclical nature of my 16 chemo infusions, which was complicated because here, and I live on the Front Range in Denver, Colorado, we had a very wet spring. And so my allergies were in high gear. I developed a lot of inner ear inflammation, and I had some acupuncture because I was suffering horribly from um, a lot of nausea, and all of that caused the inner ear crystal to dislodge one night while I rolled over in bed and launched into vertigo. And so I had a heck of a time. My experience was that I just kept uh, bringing these things on myself that had nothing to do with my treatment, but it led me to ask my medical oncologist for a referral to a therapist to help me deal with my spiraling depression because I was thinking about not finishing chemo. And so fast forward, I actually ended up realizing that there was a shortage kind of in what I call workforce development training opportunities for, in this case, clinical psychologists. And so I ended up founding a specialty here at the University of Denver that was at the time one of the first in the country to offer this type of training at the graduate level for these clinical psychologists. So now I advocate. I'm no longer in corporate America. That's an interesting story, but I'm a storyteller advocating for what I call the intersection of mental health and cancer. So um, I've written 3 books, and that's not all that I do. It's just kind of a great door opener, and it's actually allowed for more exposure to get more people talking and understanding how important mental health is in the role of healing after a cancer experience.
Thank you for introduction, Diane. I mean, we've met about, I would say, a year ago, and you've been
Uh-huh.
following the journey of building the after cancer. And always heard about your book, followed your journey of like publishing the latest book. And then this summer, I got the package of the 3 books that you gave Caroline, my co-founder. And so I was like, okay, this is going to be my summer reading. And I think I read this book that we're going to talk today. I think I read it in like 2 days. It was like 2 afternoons on holiday. I loved it. I was like, I knew you. So first, I loved reading the book. I was hearing your voice, and I love this. When this happened, the fact that I can hear the voice of the author made it really personal. Um, but I think it made me realize, it made me understand so many things that we talked about in terms of psycho-oncology, in terms of your passion and the work that you do. And so I wanted to cover mental health in September, and that's why I invited you and then Diane Benfield, who's a therapist, and she's working with our platform and with our patients for a few years now. And I invited you to the some sections of the book, and then like have Diane Benfield like analyze it from a therapy perspective. Because the goal of the session is really to give, today we have with us a lot of nurses and social workers and folks who work in survivorship clinics or lead survivorship departments within their own hospitals. And so I want to give them the kind of like data points or things to watch out when a patient is behaving like this. It means that, and just give you an idea of what the patient is going through, but also like what are the tools that you nurses and social workers can use to support patients where they are if you don't have a psychology or psycho-oncology department with your hospitals, which unfortunately it's most of them. And so that's the intention for today. Diane S., I don't know if you want to start just by maybe introducing your book, the one that we're going
Sure.
to be reviewing, and I think that's going to give everyone's a bit more context.
Absolutely happy to, and thank you. And again, I'm not here to sell books, but this book I'll try to. It's called The Unlikely Gift of Breast Cancer of all things. And many of you might be wondering who has the audacity to call cancer a gift. And as it turns out, I for 2 reasons. One is the self-discovery that happened. I went through my experience, as I mentioned, 10 years ago. I was age 50 then. And so it was a very symbolic time in my life. Going through this, learning more about mental health and cancer really helped me find my voice, gain a lot of self-confidence. I had been, and I have kind of a twisted sense of humor, so please bear with me, but I propped up people for a living for many, many years as a business writer, nominating them for awards, covering up for their mistakes, and I got very good at that, unfortunately. But secondly, the second aspect of cancer and being an unlikely gift is the fact that as a result of not just going through breast cancer, but the research that I did, my this book, The Unlikely Gift of Breast Cancer, is written in memoir style and a very conversational, like we're having a conversation. And my father, who passed away in 1997, was like my hero up until the age of when I was 5 years old. And then he ended up going to spend 6 months in the psych ward of a veterans hospital in Lincoln, Nebraska. And he stopped being my dad. He came home very heavily medicated. He was suicidal. And I always carried the guilt with me that maybe I was the reason that he developed this depression, is what it was called. anyway, researching for this book, I talked to family members, and it turned out that he likely was experiencing what we now call post-traumatic stress disorder, PTSD, from his time in the Korean War, 15 years before he was sent to the hospital. So it was a discovery, and it was just such an amazing gift to uncover that accidentally due to cancer of all things. And so it's really an appreciation of how transformational this experience can be, depending on the process. And I look forward, Diane B, to you sharing more about that. I did so much self introspection, and I learned so much about myself and found my voice.
Diane B, I don't know if you want to comment already on this comment
Go
before
to go to town. Go to town on me, please.
Well, I love it. And I mean, what I learned in 2018 from knowing nothing really about cancer to being thrown in the deep end at Cleveland Clinic
Yeah.
was that basically the general population, they don't have any idea about oncology. They just don't know.
Right.
So unless you know, you know. And what I discovered, there's so much to cancer that that I had made suppositions about. And one of them was that people were going to be really sad and it was going to be so miserable and depressing. And it was totally the opposite of that. And so Diane S, I can really, I hear you when you say the unexpected gift, the unlikely gift, the blessing of cancer. I mean, it seems like such an oxymoron, but honestly, that's 98% of the patients I've worked with have that in their story. This unlikely good things that came from cancer. I mean, who could even fathom that? I couldn't even fathom that before I worked in the field. So I agree completely. And that's why it's so energizing. Yeah, there are some difficulties, challenges, but life is full of the challenges. And in this milieu of working with cancer patients, people find a way. And I did my dissertation on post-traumatic growth, which hopefully we'll maybe talk more about later, but I have seen that unfold in the majority of my patients.
Thank you for covering that. I know it's something that I've heard you talk with the after cancer patients several times, this like growth that comes after cancer. Okay, let's get started. When I read chapter 4, it's one of the chapters where you're getting your diagnosis, but you still don't know exactly the end diagnosis. You don't know what treatment you're going to get, and there's a lot of unknowns. And I'm actually going to drop here the quotes too, so you guys can read it and you don't have to only listen to my thick Portuguese accent. But you wrote this quote that really resonated with what I've been through as a caregiver. The brief moments of triumph and compassion in the first days after my diagnosis continued to be overshadowed by the fear of the unknown. Breast cancer was a contrast of emotions like nothing I had experienced before. Let's talk about this unknown and how can we give tools and what tools can we use to navigate the unknown? Diane S, I don't know if you want to go back in time and like revisit how you were feeling at that moment, and how you overcame this fear and this being in a place where you don't know what's going to happen next.
Absolutely. The context for this moment really is I'm waiting to hear whether or not cancer has metastasized throughout my whole body. So we knew it had traveled to my lymph nodes, but I had had a PET scan and it took 5 days, which may be normal. I don't know. I should have learned by day 3, but I kept playing phone tag with it was actually my breast surgeon that was calling to try to get a hold of me to tell me the results. And we kept missing each other. It was horrible. And I had been so terrified before that point of MRIs. I had to have a breast MRI before that, and I was just so afraid. And the book is very graphic, talking about the analogies that I made for my fear of just being in a confined space like that. And so I was so relieved after I completed that first breast of many breast MRIs, and it was like little victories. And so I was up and down and up and down. Okay, this was cool. I survived this, and I've got so much more that I don't even know yet. And so that is what I'm referring to, is just this back and forth. Should I be happy? Should I be grateful I survived the test? Should I be afraid now? Should I be worried? And so every day I just felt like I had this meter that I was measuring anxiety. Am I supposed to even be happy right now? How am I supposed to feel? I was just so confused. And so that's the context for that.
Thank you for explaining that. Diane B, in your experience working in cancer centers and supporting patients through their journey, what have you seen in this early stages of getting diagnosis, of dealing with the unknown, and what tools can you share with the attendees today, to help them support their patients?
I would say the most amazing superpower I have as a therapist is being able to normalize this for patients, because when patients come in, they're new, they've never been here before, this is a new landscape. To let them feel that this is normal, that the fear and the uncertainty, the unknown, the fear of the unknown, is normal, and you're not crazy, and to support them there. I like to connect people as soon as possible to others so they can see for themselves that they are not alone, that other patients struggle with the same thing, and that we just get through it together one day at a time by talking about it and talking through it. And that's what I would say is what I would do in the beginning stages. Because there's nothing more you can do. It's a hurry up and wait.
Yep,
So we have
absolutely.
to hurry up and wait together and realize that it's going to be like this for forever. You're going to be doing a lot of hurrying up and waiting, but not as much as you do in the initial stage,
Yeah.
the workup. But you're going to get through it, and we get through it together. And somehow, magically, the group process is so important to me. It's not like the group changes anything. We don't make any magical outcomes any different, but somehow carrying the load together makes it a lot more bearable. Yeah.
And something that I didn't put here, I think there's other quotes where Diane is talking about how her husband was dealing through it, and I've been through it as a caregiver myself. Diane B, any tips on how, like, what's the role of the caregiver, how to normalize this for the caregiver, and how to support the caregiver?
Oh, absolutely. I'm probably going to say this ad nauseum, but there are some agencies out there like Immerman Angels and Fourth Angel where you can get signed with a one-on-one mentor, and it's not only for patients, but it's for caregivers as well. So if you're a spouse of someone who has pancreatic cancer or breast cancer, whatever, you can call up and they do a little mini interview, and they do their best to match you with another spouse. With the spouse who has the cancer. So you have someone to talk to on a one-on-one basis. And it is that is amazing, getting into a caregiver support group. The one-on-one is probably the best one because they can really get to the nitty-gritty with one other person. Also, there are a few books out there written from a patient and spouse perspective, which is very helpful. And so they cannot feel alone and crazy too. One is Breast Cancer Husband. It's a wonderful one. And another one is Cancer for Two, written by a husband and a wife with breast cancer. They kind of took turns writing chapters.
I love that. I'll drop the
Yeah.
links on the chat. I've dropped here the link to Immerman Angels. We actually had Jacqueline, who's their director of partnerships, talking about peer-to-peer support in one of these sessions a couple of months ago. Diane S, on your point of view as a patient dealing with your partner going through also the roller coaster of emotions, do you want to share something about that?
Happy to. Yes, thank you. I actually am married to a retired Air Force Command Chief Master Sergeant who it's a lot scarier sounding than he really is a good guy. But he's very thorough. He's used to giving orders, and it was very frustrating for him the fact that Diane, as you mentioned in the beginning, there's more questions than answers typically, and so that was really hard for him. And so I was high on the anxiety scale, but I think very structurally. And so in my mind, I was just thinking of questions that I needed to ask, what I didn't know, what I needed to research. And trust me, I sped read more breast cancer books in probably the span of 2 weeks. And I'm a sponge for information. I, that was helpful, but it wasn't comforting. And so I'm a data-driven person. So, okay, I'm reading this, but it just doesn't make any sense because I don't even understand what this means. And so, um, my husband Rene, Rene is his name. He just stood by and let me kind of like flounder around, which is how I process information. He just let me have my space, and I was very, very grateful for that. And I tried to keep him as informed as I could. There were a couple of times though that I found myself being the one trying to calm him down and to just say, "Hey, let's let this run its course. We're going to have to just be patient. It's not a," and that's the other thing that can be frustrating I found about my cancer experience is sometimes things happen to me that, okay, well, this is typically doesn't happen. And so that was a theme. I just ended up having a lot of those types of experiences where, well, we'll wait and see. No, there isn't a test for that. And so sometimes there just aren't answers. He was not very comfortable with that. And it just kind of like made me, okay, well, this is even more complex than I could have even imagined. So having that open-mindedness, but yet being there to support each other and really understanding each other's personality when it was time for him to give me the space I needed. He was really great about that, and I appreciated it.
Yeah. Thanks
Can
for
I add something
sharing.
to that?
Yeah, absolutely.
I typically I recommend separate groups for caregivers than I do for patients because they need to be able to share openly. A lot of times people are pretending, even with close relationships, they're kind of governing what they say to their loved one to kind of protect and manage emotions and not make it worse. So I would highly I've met with caregivers one-on-one sometimes and I normalize for them. Sometimes from my point of view, it almost looks like it's harder for the caregiver because they're watching and they're not taking the medicine, they're not going to get the chemo, they're not like they don't have those things to do, but they're watching and they can't fix it. And sometimes when they hear that that their challenge in that area is validated, it helps them to be better okay with it. It is hard to be a caregiver though, especially men. Men want to like go in and they want to fix and they want to make it better, and it's harder for them, I think, sometimes.
Yeah. Um, let's move to the next quote. This is from chapter 6. This is you're waiting for results before you get treatment. And this is what you wrote. For a fleeting moment, I wondered if there were mental health professionals who understood how emotionally challenged cancer was and whether they could help me sort out my thoughts. Diane asked, do you want to give a little bit more context of what you were feeling and how you passed this phase that you were on?
Thank you. Well, again, this was that period when I had received the diagnosis. We just didn't know yet whether it had metastasized throughout my body, and it took 5 additional days after I had the PET scan. During that 5 day period, I um I kind of I had a 24-hour vigil with God. I mean, it got to that point where the longer it drug on, the more thoughts I put in my head. And I had a plan for what I was going to do, depending on what the outcome was. But I just really, I had never had an experience like that where it was like I called it this 24-hour vigil with God, literally, where I was on this never-ending prayer. And um, it was the, well, it was really, I learned a lot about myself. It was therapeutic. It was hard, and I relived my life, my regrets, my, million things. What did I ever do wrong to get this diagnosis? And it really helped me arrive at peace. And when I finally got that phone call from my breast surgeon, I was late for a lunch anyway, and I ended up being later. And I walked into this group of women and I announced that my cancer hasn't metastasized. And I didn't know most of the women in the group. I mean, I just blah. And because I was so happy that it had stopped at my lymph nodes. And I was in for one heck of a brutal treatment plan, but I was grateful. And so the thought crossed my mind of, oh my gosh, this has just been I just have been on this emotional roller coaster. Is this the way it is for everybody? And why has no one, because I hadn't started chemo yet, and with the distress thermometer, I hadn't had a chance to talk to anyone about this and to be asked about the state of my mental health. I thought, wow, I think we're missing an opportunity because all they want to talk about is what kind of breast surgery I'm going to have, and it's all about the body. What about and that was it just came to me naturally, and I parked it in the back of my brain, and then it just continued to bubble and gurgle there, and then I'll let Diane B, you take it from there.
I agree with you. The fear of the unknown is much worse than the fear of something. And we tend to blow out of proportion the what ifs before we know before we know what it is. Because once you know what it is, then you have the plan, and in the plan, there is comfort in doing something. So that's really good to let people know. And it's a shame that that's not on board way in the beginning. You know, when patients are going through the workup, that really should be part of the care for all cancer patients. And even when treatment starts, I believe patients should be given a little heads up that treatment may seem awful. Everyone wants it to be over, and everyone's counting down the treatments and the days. But really, it sometimes gets even worse when the treatment ends. And that's when kind of the anxiety and a little bit of the depression gets even worse at that point. So to let them know that this is normal and this is going to happen will help reduce some of that anxiety, I think. Hard to
I don't know
keep
if
up
you
all
want
these chats.
to. Well, we
Hello.
have lived experiences here. Thank you for sharing your lived experiences on the chat, Katie.
Yeah, me too.
Um,
I'm reading them all.
yeah, Katie says she's a breast cancer and waiting for the PET scan results was a milestone I won't forget. Um, Thank you for sharing that. I'm doing pauses because I'm like sinking in the information you're sharing, and somehow like re-experiencing it. I think all of us, if we're survivors or caregivers, like every time we talk about these experiences, we also like relive them. The next one that you have is really special for me because I've been through, I saw my loved ones doing this several times. And this is where we're talking about priorities and values. And so let me drop here on the chat what you wrote. And maybe, Diane, why don't you read it so we can hear it with your voice instead of my thick Portuguese accent?
No, no, you're fine. You're fine. Um, so this is again, we know that the cancer has not spread beyond my lymph nodes, thank God. But I'm gearing up, I guess, psychologically for chemo, which I'm just scared to death. And so one day on a walk, I just decided to prioritize. And so I make lists. I'm very structured. And so I'll just read now. I decided to get clear on where I was going to expend my limited energy once chemo started. What I came up with was my list of priorities. And number one being what I call God, the greater outer deity. Number two was husband and family. Three, self-care. Number four is my journaling. I had started journaling by then. Five is friends. Six was work, the paying kind of work, as opposed to volunteering. And then number seven was mentoring and volunteering. And I have to say, as I mentioned, I'm a structured person, and so in hindsight now, I'm not at all surprised that that's how I was leaning toward, which was to establish the structure and to get clear in my mind what was going to, I was going to make sure that I leaned on heavily was my spirituality. I'm not particularly an organized religion person, but my breast cancer experience was very spiritual for me. And I'm really glad now that I had that as number one because I did lean on it so heavily. And then husband and family, that really had a lot to do. I was very concerned about Rainy's mental state. I mean, he's such a protector. That's how he's trained. And our families were freaked out because mine in particular, we had no history of cancer in my family, which is not uncommon, I understand. But they really didn't know what it was. I mean, I didn't know what it was either. And then my husband's family, they all We were in Colorado. They all live in New Hampshire. And so we were half a country away. And I was really the first young person in their family to have a cancer diagnosis. So I was just trying to stay ahead of what I thought was going to help me get through this. And having that kind of structure really did bring me comfort. It's I wouldn't say it didn't seem silly to me. It's just that I make lists all the time. I have lists everywhere, and that's what drives me in goal setting and all of that. And it was not a surprise to me. It was really how I wanted to approach my cancer experience was in a structured way, organized and controlled by me, of course, which is the second very important part of that equation. So that's the context, but I am freaked out about having to start chemo. I'm deathly afraid.
To piggyback on what you said, it's so just reading the chat, it's so cool reading all these statements. It's so important to with patients to let them feel their feelings because I think Diane, you said a little while ago about you were managing your husband's emotions. It was like because it their loved ones are so afraid and so tiptoeing around things that patients will keep it in because they want to kind of protect the hearts of their friends and family and to give them a space where they can be angry and be afraid and feel guilty or self-pity or whatever it is they need to go through without any judgment is so important to not stuff that down, but to just let it out and to honor that as part of the process. So I highly agree with that. Very much so.
Yeah.
Yeah.
And Diane, if I remember well on the book, you shared this with your partner, and he was like, why'd you come third?
Oh yeah. Yeah. Oh, he was just flabbergasted. And of course, it's just my nature. I just how I approach things and I've probably now put myself a little higher up on that ladder. But at the time, I, being trained in public relations and crisis management, I was consumed with not just trying to understand what was happening to me and the why this happened to me, but we had a set of friends, some of our friends that, as I always, often jokingly say, had me one foot in the grave, and they're very dramatic, and so they always want to just like portray this like, oh, she's barely hanging on for life. And there were times I certainly felt like I was, but I refused to let the rumor mill and the drama kings and queens dictate this. And so I was very meticulous about, and I just sent out an email to like 100 of our closest friends to let them know I had this diagnosis because I didn't want the rumor mill to take over. That's classic me, and I apologize like the Dickens. I do not have time to call each one of you, but I want you to get your information from me, not from Facebook, not from the rumor mill. And if you have any questions, do not hesitate to ask me only. That's the one thing I ask of you is to get your information from me only. And they were, again, a little freaked out, but not too surprised coming from me that I had been a communicator my whole life. And so people, I had feedback, Diane, you were very much in control of the message of the educational parts and managing that, and it was so you how you managed that. And I wouldn't say I was proud of that, or that was what I was gunning for, was like to win some award for that. No, but I just felt better knowing that I was controlling the message, and it has nothing to do with my health or what I'm even experiencing. It's just something I had seen go so very badly time after time in my career that I wanted to, that was just really important to me at the time.
Could I add something there, Mariana?
Yeah, absolutely.
I love this topic. I let my patients know very early on that whether you like it or not, you are now a de facto educator about cancer because most people don't have a clue. They all think you're going to die. They have no idea about treatments or stages or pathologies or anything like that. So your new role is a de facto educator, and that can be wearisome. So to normalize that and let them know that. I also let them know about Caring Bridge, which is a great website where you
Mhm.
can put blasts out about what you're doing so you don't have to tell people 25,000 times. And also one more thing Diane was saying about her list and her priority, letting I have heard this from so many people. The one of the unlikely blessings of cancer is the fact that it forces you to prioritize, to simplify, to slow down, to choose what really matters, to like let go of the silly stuff. You know, that just it just kind of all just melts away. And a lot of people don't realize what a blessing that is. And it kind of takes the 2x4 treatment of getting a cancer diagnosis to do it. So it may be difficult at first. And you have this personality where you kind of list and everything, but a lot of people don't. And this forces them to do that, and they like it. Yeah.
Thank you. I want to make sure that we have some time for Q&A at the end, so I'm just gonna maybe like move and change a little bit the list that we have agreed with both Dianes. During treatment, you talk about mood swings, and so let me paste here the quote. You wrote, my mood swings were puzzling. Why was I such a grump when I had been given a chance to survive? Many amazing survivors lived healthy, fulfilling lives. But what if I was at the beginning of years-long struggle with cancer? Um, Diane S., do you want to set some context for this quote on your book? What you were going through?
Sure. So this is actually um, really the day that the door opened to my interest in psychosocial oncology. It was my meeting with my medical oncologist, and it was the next to the last chemo infusion, and it was Taxol. And it was when I first started questioning. I had been spiraling. I was depressed. I was thinking about stopping chemo early. And I just had all these questions, and my oncologist wasn't that helpful. And I understand why now. She just didn't have a lot of answers. She didn't know of a therapist who specialized in working with cancer patients. And because I laid out for her specifically what I needed, of course. And she goes, well, you and your questions, just calm down. I don't know of anyone. I know they exist. I just don't know of anyone. But if you find someone, health insurance likely won't cover your therapy. And I go, I don't care. I feel like I'm losing it here. My mental health is really important to me. And she goes, well, be sure to check out our breast cancer support group there at the hospital care center where I was being treated. And I said something horribly, but it kind of speaks to my mindset. And I said, making a quilt block is not going to make me feel better. And I was kind of sarcastic about it. And she's like, um, I went on with it. I got through it, but I hated the fact that I never felt good. And I was grouchy and grumpy, and I was scared to death that I was just never going to feel good again. I couldn't remember what it felt like to feel good, to not feel nauseous, to not feel achy, to not feel worried about something and then what's going to happen next. And my brain was in overdrive. So I called myself the Archie Bunker of like breast cancer. And I was trying to make light of it, and I couldn't. I wasn't funny, and I was just struggling. And um, I just decided, because I was trained as a print journalist, I said, I'm just going to go all Geraldo on this and just start calling people and asking. And that was what led me to the University of Denver. And I had some contacts there. And again, these are clinical psychologists because I knew people there. And they started teaching me about behavioral health. And I go, I'd never heard of behavioral health. Well, it's, not so new, but kind of new, relatively speaking, but it's becoming much more mainstream, intersecting mental health and whatever ailment that we're talking about. So this was the first inkling I got, and it all happened because I didn't like who I was becoming. I was just so sick and tired. All I talked about was cancer, and I was just sick and tired of me being a whiner because I just never felt good. And so that's the context. Unwrap that.
I love that. And my answer to almost everything is mentorship and group support. Because once you get a mentor that is matched to you, you ask questions, you emote, they listen, they empathize, they truly empathize because they've been there. And then I try to I encourage people to become a mentor sooner than they probably think they're ready for, because when you are helping someone who's even newer than you, and you are listening to them and you are pouring out your attention and time for them, that's a very healing thing. And the new person will hear that the mood swings up and down is a very normal thing. I can't stress that enough, how important that is. And to be with other cancer patients, because cancer is very isolating, just the disease itself, because it's in your body. And then when it's just you, other people, a lot of people, they just don't get it. So they withdraw, or they are superficial. So to be in a room with other people, and you're not in your own little silo anymore, and you hear other people's process, you hear them being kind of raw with their anger or their guilt or their sorrow or their fear or whatever, it unlocks something in you and allows you to be okay with your ups and downs. And one of the best quotes ever for just about anything is, "This too shall pass." You know, the good times, the bad times, nothing is going to be around forever. You're going to have ups and downs. You're going to ebb and flow, and that's part of it. Yeah.
Any comments on your side, Diane S?
Um, I love this concept of mentorship, and I've always been an advocate for mentorship. And let me just say that I reached out to a few breast cancer survivors soon after I was diagnosed, before I knew a whole lot, and certainly before I knew whether it had metastasized throughout my body. And I got to be honest, I would just caveat, Diane, to be very selective about these mentors, and that it's important that they be sensitive and trained and understanding, because these survivors I reached out to that I knew but I didn't know well, they were well intentioned, but all they talked about was how they had thrived. It was about them. It was about their experience. And so I was kind of in, and I think there were two of them, and neither asked me how I was doing or feeling. And that was what my expectation was. And so I'm not criticizing them. I'm just saying I expected that there would be a lot more compassion, and there wasn't. And it was really important, especially one of them I met with, that she made sure I understood everything she had done right. And it was kind of horrifying, and I just sat there and took it. And she started really kind of preaching at Rini about what he should and shouldn't do. So the moral of the story is um, that it is so important to just not assume when you reach out to anybody that they are going to be understanding and compassionate, because this is a trigger for them too, right? This is maybe the first time they've talked about their own experience, because no one ever asks them anymore. So I learned a whole lot from that, but it was just not a great place for me to start from. However, it really set the stage for what became this interest and this passion that I have now, to be compassionate, to understand that the brain is part of the body, and why paying attention to your mental health, the state of your mind, is so important, because it impacts your body's ability to heal itself. So there's a mouthful.
I let patients know, we talk about this concept of pathological positivity,
Mhm.
where you're just positive at all costs, and
Yeah.
that's like really harmful. It's not realistic. It's not appropriate. It leads to a lot of guilt and shame. And I let the patients know, research actually shows that those patients who emote and let their anger out, and they challenge their oncologists, they ask questions, they advocate for themselves. Yeah, toxic positivity, that's
Love
it.
it. Yep.
The patients who challenge their doctors and ask questions and advocate actually have better outcomes. So
Mm.
as far as the mood swing goes, when you are letting it out, you actually do better than if you're just stuffing it and pretending it's not there.
That's interesting. Last quote. I think we're going to run 5 minutes over time, if that's okay. If you need to leave before, go ahead, but we need to dissect this quote because this is at the end of the book, and I think comes back to unlikely gifts,
Mm.
growing from pain. And so in these last chapters, this is chapter 18 and 19, you're going through, you're talking about the fact that you're having time to think and review and reposition and like think about your values and what do you want to do next. I don't know if you want to read it. Diane, I see you have your glasses on, so we can hear this last quote with your voice,
Thank you.
and then dissect it.
Sure. So I pondered the irony of how cancer had forced me to slow down and consider the possibilities for my future. To my amazement, breast cancer was allowing me to begin thinking about living and leading with my heart instead of my bald head. Breast cancer was continuing to help me achieve clarity of the whys of my life, encouraging me to revise my life story. And I have to say, the one word that sticks out from all of that is clarity. And um, this, as Mariana mentioned, is kind of the culmination, everything coming together at the end of the book. And I'm finally able to figure it out, put it all together, put the pieces together. And what I'm realizing is that this has been a transformative year in my life. Life changing, certainly symbolically. I'm now 50 years old. What I kind of see as the halfway point of my life. And by golly, I am going to shed a whole lot of things. I'm going to focus and I'm going to get real clear on what matters. This has forced me to do that. I have a lot more answers. I have better, greater understanding of myself. I know who my real friends are. And I don't mean that in a terrible way. I just mean I understood who gets me and who kind of tolerates me, and that was healthy. And cancer helped me understand that. And so this sets the stage for what turns into my ongoing advocacy work, to this specialty I founded called Cope, to what became my first book, and just all the encouragement that I got to tell my story, which I didn't think was that unique. There were a lot of unique and bizarro things that happened to me that makes the book kind of unique. And Mariana, you may really relate to that. I experienced cancer differently. If I could have messed up at every point innocently, I seemed to do that. I got sick a lot, but it just was, by the time I finished, I felt like I was at the peak of a mountain, like I had just climbed a mountain, which symbolically I kind of had. And then I was not going to let back on the throttle. I was going to live life more meaningfully. I was going to live life for those who I met and saw that likely were not going to survive their cancer. That was a huge impact on me. And it's heartbreaking, but yet that inspires me to keep moving forward.
I love so much what you said right now. One of my favorite books that I offer to my clients is Man's Search for Meaning by
Mhm.
Viktor Frankl, and how suffering um, is a gift that we can give others, but we have to go through it ourselves first. And you can serve it up on a platter. The comfort you have received in your suffering is something you offer as comfort to others. It's a beautiful thing, and making meaning from suffering. It really, there's no such thing as a life without suffering. And this your suffering, and we're going to get through it together. And those of you that would love to program, there's a great Dr. Breitbart is a guy as a doctor in Memorial Sloan Kettering, did a whole lot of research on groups first for advanced cancer patients on making meaning, and he fashioned it after Viktor Frankl's work. It's great. It's a 16 group scripted amazing program if you're looking for something. I like also this vision casting. To you have this new scared patient comes into your office, into a group, and they don't know any, they're in the workup stage, they don't know what's going on yet. And when they hear other people saying like things that Diane just said, it's hope giving, it's vision casting, like it's not the end of the world. I'm going to get through this. I don't know what I'm doing, but that girl over there is getting through it. And it's such an amazing tool to like infuse someone with hope that, yeah, I have no idea what's going on. I'm going to get through it because that girl over there is getting through it. And then the last thing I wanted to say, I was brand new oncology social worker. This guy comes into my office and he's in his 60s and he's beat up. He sits down and the first thing he says to me, getting cancer saved my life. Like, what? I'm thinking, what? Because I didn't really know anything yet. I'm still like on a really, really big learning curve. And he started to go on to tell me that before his cancer diagnosis, which was it was pancreatic, it was a major one. And he said, I was going through the motions in my life. I was just kind of trying to get through each day. And here I am, like beyond midlife, and I'm not living. He said, I get this diagnosis. He said, all of a sudden, I make priorities. I say no to like a lot of stuff that I never really liked in the first place. And I'm living on purpose. And it gives me goosebumps now remembering it because I had never heard that statement before, like come out of someone's mouth, getting cancer saved my life. But I've heard it a lot in maybe not those exact words, but in the same intention that getting cancer, I didn't sign up for it. I don't want to be in this club, but I'm here and I'm telling you, I've grown in some amazing ways I never would have expected.
I was just going to make a quick comment that my heart is warmed, and we obviously have either accidentally stumbled on, or many of us saw the what I call deficiencies in the process of treating cancer. That there was not, continues to not. We can do better always, but this paying more attention to the state of one's mental health is the reaction, and the fact that there's these incredible tools and resources now that either I couldn't find or didn't exist 10 years ago. it just it's so exciting and it's so important. And I hope we can continue um, to just build in this area, because it is so important, because this can be such a horrific event, and it's sad, and we still lose way too many to cancer. But for those of us like myself, it's just become such a meaningful part of my life. And I'm just grateful that we've got resources like those of you all on this Zoom call today that are devoting your careers, your lives to this topic. I'm so thrilled, and I just thank you with my whole heart. And for what the After Cancer does to kind of
Mhm.
put the arms around not just the mental health piece, but other aspects of survivability. Just thank you so much. These resources are so important.